I am very happy and excited today to have a conversation with Maja Guldborg from Denmark. She's a veterinarian and she is a vet chiropractor. And everyone who knows me and my channel knows that brain stuff and nervous system stuff, I'm like super interested. And I think it is very important to integrate those topics and to create more awareness in the horse world, that we have to think about that and learn more. So, welcome, Maya. Thanks for taking the time to have this conversation with me today.
Thank you, Nancy, and thank you for your interest.
Yes. So, I think I would like you to start like explaining to people a little bit what you're actually doing and what might be different from what they have thought of so far concerning horses. Because in my daily training profession, which I have with horses and people, I see so many issues which actually, in looking at the horse in a holistic way, people still miss. And I think it is very often because of a lack of knowledge and a lack of awareness that there are all these topics we haven't thought of so far. And I would like you to explain a little bit what you're doing actually, so that people can understand, because you are not like the typical horse chiropractor I meet. So would you explain to the listener what you do?
Yes, and thank you. First of all, I'm not going to explain what I'm going to do, but the thoughts behind my examinations and my treatments and my rehabilitation. I have my own practice, and I have had that for since 2004. And after the veterinary chiropractic education, I have done the human fellowship of the International Board of the Functional Neurology and also the fellowship of the American Chiropractic of Functional Neurology.
Hmm.
So I have tried, if this is 100% of the brain function, there is so much we can't use on the animals because we can't ask them
Yeah,
and make them do things.
yeah,
But let's say that if you have 100% and we can use maybe 30% on the animals, I have tried to understand the 100% in order to do the 30% as best as possible
yeah.
because everything is connected and talk to each other. So in my practice, I am specialized and I don't do regularly veterinary work. So everybody's schedule for me is for this one.
Yeah.
So I do, as every other veterinarians and chiropractors, I do the gait analysis because the gait is window to the brain. I come back for that later on. And then there is the functional neurology examination, which is the huge thing because this is where you find the why. And then I do the chiropractic treatment, maybe acupuncture, maybe laser, whatever I think is adjustable for the animal. And then I do a lot of time on neuro rehabilitation.
Hmm.
And I think after the speak, you will understand a little more about why neuro rehabilitation is so important. And nobody does it in the veterinary world.
Yeah.
Because when we do the veterinary studio and also the human medicine studio, we learn a lot of neurology, but we learn the neurology static.
Yeah.
We learn a lot of Latin glosses and it's so boring and it's really difficult because you have to memorize it all and we don't know why we should do it.
Yeah.
We don't understand the function of it. And unfortunately, during the studio of veterinarians or the human medicine, we learn about 95% about pathology, but only 5% of function.
Mm.
But in the real world, it's the opposite around.
Yeah.
So many more individuals have dysfunction in the nerve system. And if you wait long enough and you force the body long enough, then you will have pathology. But it's rarely pathology in the beginning.
Yeah.
So we tend to look at the body as if it was a car. So we are like mechanic. So if you tell me that you have pain in your elbow, we look in the elbow and we treat the elbow. If you have pain in the hip, we look at the hip and we treat the hip.
Yeah.
But you cannot do that in a body because we have to be aware that the body is just a body and nothing is in the body is working if we don't have a brain. You could not
Absolutely.
stand on the floor if you didn't have a brain. You couldn't breathe, and so on and so on.
Hmm.
So let's take an example. Let's say that you have this horse and it's lame on the right front, and you have done all the joint injections, and now you know that the fetlock is the one who gives the pain. So traditionally, we treat the fetlock. We want to get the inflammation down, and after that, we can ride again. And maybe we have to do it again, maybe a month later, because it's still lame. It's maybe 50% better, but it's still lame, so we inject again.
Hmm.
And then we can go on doing that many times. And sometimes the lameness is shifting to another leg after treating that fetlock. Um, but it's very annoying and it's one of those things who make me go the way I've done because I was realizing I stood in the orthopedic world and we were looking at one joint, ignoring the fact that there was more than 100 joints in the spinal cord who controls the joint. And what controls the spinal cord? That is the brain.
Hmm.
So this has become my why. I want to know why it happened before that, or if I don't know the why, I don't know what to do about it.
Yeah, I love that.
So if you think about it, you have a joint with inflammation. Then I want to ask you, what is stabilizing the joint? A lot of people will say the ligaments and the
Muscle.
ligaments, huh?
They will say muscle as well is always an answer.
Not so many would say that, but many would say the ligaments and the tendons. And that's true because in each joint we have maximum of 100% movement. And then we have the ligaments in the edge to
Hmm.
control that we don't go beyond the 100%. But in the end of each tendon, you have muscles. And the muscles is controlled by the brain.
Absolutely.
So if the muscle is not working properly, we don't have stabilization of the joint. So therefore, you have to think back. Why is this joint reoccurring with inflammation and pain and injury the same region? Um, so what happened is that when we treat the joint, the horse has been in a compensation pattern for a long time because it registers the pain, so
Yeah,
it will compensate. And also, the reason why you get the pain is because you have dysfunction in the nerve system. So what we don't treat by treating the inflammation in the joint is the pattern in the brain. So
exactly.
the horse continue to use the same compensation pattern in the body, in the biomechanics, and therefore you have reoccurrence of the pain in the fetlock or a new injury.
Hmm.
So what I would like people to know is, and think more about, is that the brain, think about it as the cockpit in the airplane. It knows everything and it controls everything. So the brain is the one who's activating and controlling the body. But in order to do that properly and correctly, it has to have feedback from the body to be
Exactly.
working 100% good. But if you have issues in the body, then you don't have this afferent information. So every muscle in the body, every joint, every tendon has receptors. And those receptors, you have to think about it as the postman for the brain. So they inform the brain about this muscle. Is it tense? Is it relaxed? And in which degree? And so the same about the tendon. And the joint is informing by the receptor about where, in which position is the joint. All this afferent information to the brain is processed in the brain, and then it's coming back to the body. So let's say that you have decreased function in the fetlock, so decreased range of motion, then you have decrease in the afferent information to the brain about the fetlock. So now the brain will acknowledge the fetlock less, and therefore it cannot control the fetlock. If you don't know where it is, how can you control it?
Yeah.
So that is an evil circle. Um, think also about the muscles. We have a lot of different groups of muscles.
Mm-hmm.
The overall group, we have stabilizers and mobilizers. So the stabilizers muscles, they are the anti-gravity muscles.
Mm-hmm.
And they have a great job to do because if you're not stable on the ground, you cannot move properly. It's interesting that, when I have taken all those modules in the human practice of functional neurology,
Mm-hmm.
every time we see cases with patients, and Dr. Carrick, he asked the patient, no matter what kind of issue they have, what is the most important thing I can do for you? And all people say, I would like to have more balance. I would like to be more stable.
Yeah.
So even though you have problems speaking, you have problems use your arms, you have problems whatever it must be,
Mm-hmm.
the stability is the important thing for the people.
Yes.
And I guess it would be the same for the
For the
horses.
horse. Yeah.
Think about the horse, it's a fight and flight animal.
Absolutely.
If it's not stable, it would never be calm and in harmony mentally.
Absolutely.
So the problem occur when you have to use the mobilizers for stabilizing,
Which happens quite
which
a lot actually when you
all
look
the
around
time.
how horses are being moved by people and
Yes.
then how they learn out of, because what you said, I make some notes in between to come back to points which I think are important for the listener.
Mm,
When you are in a compensation pattern neurologically, because you have like diminished information flow, or you have, I don't know, for example, pain receptors, there is a pain, then it's a different type of receptor sending information to the brain. And then the primary movement pattern, because people always think, oh yeah, after the injury is healed, let's call it,
mm,
then the horse can move like before. And I'm like, well, it can be if it was a very short period in a compensation pattern, but the moment a body moves, if it's human or horse or cat or mice, I don't know, moves in an altered pattern, a compensation pattern for a very long time, that becomes in the brain. The brain learns. The brain is a
yeah.
is a structure which
We come
always
back to that later
changes.
on.
Yeah,
Yeah.
it's like by experience and what it's doing, it's building. That's neuroplasticity. So they stay stuck in those unhelpful patterns, even if the issue is that the tissue, for example, the tissue damage is healed or something.
Yeah.
But continue. It's like,
You're
yeah.
absolutely right. And you cannot imagine how many writers thinking that they can write by mechanics.
Mhm.
Let's say that they have to lift the back.
Mhm.
Oh, I can ride my horse so it lifts the back. Or they say that I have trained my core muscles on the horse for a long time. But the problem is Every muscle need a nerve impulse to work. And now I put a picture on. So if we have this brain up here, and then imagine that you have a lot of roads to the body. Let's say that you have had an accident and now you have like a landslip, a lot of stone on two roads, which happen to be the roads for the core muscles, where the nerve impulse should run.
Mhm.
Now the cockpit, the brain, it says, okay, I cannot go down that road. I have to pick another road.
Mhm.
I know what to do, but I have to take another road. I will come to this area, but I just do it another way.
Mhm.
Now you're starting this compensation. And also, as you said about the pain receptor and the proprioceptors, which is the mechanoreceptors with register movement and tension, they are inversely correlated. So if you have decreased function in the motion, you will have increased pain. The same here with the muscles. As soon as the compensation in the musculature is starting, the core muscle is even less active.
Yeah.
So now you are starting this evil circle. So even though you're a good rider and you can ride the right biomechanics, you are just strengthen the compensation pattern in the horse.
Hmm.
And by doing that week after week, month after month, um, you are just getting closer and closer for the injury.
Yeah.
Think also that we have a brain which has two sides. We call it hemisphericity. Nobody has 100% function in right and left side.
No.
So let's say that when you was a little foal, you have maybe a head injury or whatever. So now you have big asymmetry in the function of the brain. Then you also will have it in the body.
Hmm.
So let's say that you are having 70% tension in one side of the body and only 30 in the other side. And you're going to ride the horse, you're going to perform at a high level. Now that horse will compensate big time.
Absolutely.
And at a certain point, you cannot anymore. A lot of those horses, they are also mentally distorted.
Mhm.
They never come back to normal mentality if you don't create this balance again.
Yeah.
Is it something that you see?
I will just see like my notes I've made. So first of all, this looking for the why is I loved how you phrased that because it's so often I mean the simplest way and how we in our I even like sometimes find the word biomechanical strange nowadays because it's so mechanical and there's so much more going on. And actually from the training perspective from my profession, I'm not only thinking of actually the physical function, because to me, like, I mean, the nervous system is you said it's like the postman and,
Mhm.
bringing the letter. So it's like our brain and nervous system, and people think that it's a different thing, the brain and the nervous system. Actually, the brain is and the nervous system is one system. It's like one huge brain or one huge nervous system. You cannot really separate it. But it's like for me, I always say it's the information system for everything. And for example, on a physical, from a physical point of view, when people think like, oh, whatever, these things like you said it in the beginning, I had to think of yeah, training dysfunction. It's like people say, "Oh, my horse doesn't back up well," and then they say, "Oh, back up on a hill that will like create force." And I'm like, "No, if I have a dysfunctional backup on the ground, the hill will not. It will make it more dysfunctional. You will train the dysfunction more." So it's like there's these training things. The same thing that people think like, "Oh, yeah." a shoulder in, for example, will help my horse to flex the inside haunches. I'm like, no, your horse needs to flex the haunches to be able to make a shoulder in correctly. So it's this, where do you start? And if the information system, for example, I always call that in German, I call it ansteuern. I think in English, it's like how you can consciously activate a movement. And there you are again with what you said in the beginning. The human brain has, with its big frontal neocortex, we have a different possibility to interact as well when you assess a problem, because you can ask questions. You can say, oh, do this movement, try this. So with a horse, that's limited. But a lot of horses I see really try to find good movement answers to requests, and they are just not even capable, for example, of activating in a moment. For example, the abductor muscles of the shoulder. I see very often that horses, literally, I am standing there, I'm like, he doesn't even know the muscles are there, you know? So it's like, and then it's like, I'm like, how do I want to train a correct movement to strengthen my horse for whatever my goal is? If the horse is not capable
Mhm.
of sending the information from the brain to activate that muscle. So I need to think differently. And when I continue to train, and that's the second part from a trainer perspective for me, each time I ask something which the horse cannot really do, I I put the nervous system into a dysregulated stress. I go up to stress. So I put it in a dysregulated state. So after a certain state of stress activation, um, learning goes down as well. Because I mean, I need to have a certain type of arousal to be occupied with a task, but if the stress level is too high, and that is very individual for different horses, um, they won't learn. And
Mhm.
that's like from my perspective, a lot of the rehab horses I have are as well like behavioral rehab. They are not behavioral rehab. For me, they are nervous system dysregulated and they need to come down. And then you have those horses, what you said, you can be a tricky rider and put them in a position and continue to train, however you want to call it, over the back and make them carry with the hind legs or however you want to phrase it. But, and horses are very adaptive, not in a healthy way, maybe.
Brains adapt.
Yeah, they will
Yeah.
try. They are super friendly and they will try, but
Yeah.
they will go further down that really bad path, which puts them in more and more and more dysregulation. And then when, you know, especially when you have pain, pain rises stress levels as well. So actually it's this, how you call it, you're in this bad loop,
Yeah.
which is really difficult to find a way out.
Problem is that people don't understand that their horse is not able to do what they want.
Yeah,
I once had a client, which was one of my colleagues with her horse, performing at a rather high level.
yeah.
And the horse was hypertonic in all muscles in the body.
Hmm.
And I said to her, you have to go down in a period and not work the horse, because if the muscles are hypertonic, you cannot get 100% movement,
No,
because it's just um, it's just a wrong pattern in the brain. And she said to me, I have to exercise. It's difficult for the horse to do the flying chains. I have to practice.
yeah,
I said, no, you cannot practice on hypertonic muscles. You have
exactly.
to wait a few months until we have worked with this and the muscles are relaxed, and then you can try again, because now the horse will be able to do it. No, I have to practice.
Yeah,
And this is where I'm just confused and frustrated, because it doesn't make sense.
yeah,
So many people in this horse will think that what's difficult for the horse, we have to train it again and again and again. And they ride 7 days per hour, per week.
yeah, exactly.
And just many people, they ride 1 hour at a horse, maybe 1.5,
Yeah,
because they continue and continue and they continue until the horse gives off, give up, and it's just sore in all muscles.
yeah.
So, and they end up in a long, exhausting, frustrating examination course and treatment course.
Yeah,
And some of them, it's years and it costs a lot of money. And they have been for 10 different veterinarians and treatments. And, it's very frustrating.
absolutely. And I'm glad you say that because this repetition, when it's difficult, there's another aspect which people often from they think like, oh yeah, I feel my horse is not having the strength to do this exercise now. So I will ask one more time that he does it well, and then I'll give the break. And I'm like, if I do, I mean, I don't do 10 push-ups. That would be a big lie because I'm really bad at push-ups. But if I reach the point where I cannot repeat a push-up, if you ask me, okay, so do one more a good one, I will
Mm.
just not be able to do it. And
Mhm.
it's when you think like a human, I would call it, I always say like don't think like a horse person, try to think like in normal terms for yourself. You can answer yourself that, oh no, actually that doesn't make sense at all. The
Mm.
only thing it would do is that you get demotivated, stressed out, more fatigued, and physically for sure, that's the moment as well where you have risk for injury.
Yeah. And everybody look for the quick fix,
Yeah,
you know? And that's not you cannot do that if you have a body.
no,
Um, because as I said, everything is connected.
absolutely.
So we have to start to look at the horse from the beginning. Already as a foal, if I see four foals,
Hmm.
let's say 3 months old, there's only one of those four who's well in the body.
Yeah,
So how can you imagine that this foal, not the one who is good, but the other three, how can you imagine that this would be very great when it's 4 years old and now it
yeah,
has to compete and be ridden very often?
yeah,
It's not going to happen because that brain is in the beginning of the life in a wrong pattern.
yeah,
So the brain does not know what is the right function.
exactly.
So, and also in the first year of life, we have and that's for all, we have a weak core. So in humans, we are like babies, we cannot do anything, and then we start to try to move a little and lift our head, and then we try to crawl and so on. And the doing of that is activating the brain and the cerebellum and creating the extensor tone, and now we can come up and so on. That's the same for the horses.
Hmm.
So when we have horses in what do you call it? When you have a lot of youngsters in the same paddock.
Yeah, we have like in these nursery
No,
groups,
no, what do you call it when they grow up in a
yearlings.
herd?
Yeah. Well, it's not really a herd if they're all the same age, but
No, no, but in the
yeah,
same
paddock, pasture.
lystdrift. What is the word for that?
I have no.
Instead of having its own little box,
Yeah, yeah, and
they
they have
are, and
in a pasture. They're outside in a group living,
yeah, okay.
moving.
When they're in this group, let's say it that way, then they are playing, of course, and that's very healthy
Yeah,
because the body has to move. But many people they ignore when if they are not getting along and
yeah,
if it gets too wild.
yeah,
So sometimes they are, they raise up and they fall and they do a lot of things. And this is where you have the chronic patient.
yeah,
Because in the grown up time, when you are so weak in the core, you cannot do an accident without having a chronic fixation in the body.
yeah.
And now you have the problem started. So So I always, when I have a new patient, I get a feeling if this is, wow, this is one who have had it from
Mm-hmm.
very early,
Mm-hmm.
or this has been a very good performing horse, just have a newly acute accident.
Yeah,
And the first group, it takes time
yes.
because the brain don't know the right function.
Yeah, I love that you say that because I mean we all, people think of when they think of if horses grew up well, when you go, I mean, it's difficult to really find a healthy horse today, actually. And people think of, oh yeah, they grew up, for example, in the south of Germany, you have more hills and mountains, you have like different terrain. So very often the horses which grow up there outside, they have more, let's call it sensory input from the environment already. So they have a different, while the nervous system, the brain is connecting. That's why when they are young as well, sometimes they have these uncontrolled movements because the nervous system actually, pathways are not myelinated and they are like not, they are learning this, like what we see in babies, they overstretch and the head falls back, it's like the brain learns how to control this movement and how to balance itself in it. And people often think like, oh, if just the outside circumstances were right, then everything is potentially better. But a lot of things play in that, what you say, when it gets too wild, for example, if you have groups just of young horses, already that's a problem as well, because in nature, there would be the adult horses going in between saying, stop, this is too much, because they
Mhm.
know. And this is funny because people often think, oh, that's just wild play. They love to play. And
Mhm.
then you see that, I see that very often in gelding groups. You have those, I always call it like, I call it incompetent geldings together, then the ones who grew up like that, they continue to play in similar ways, the
Mhm.
ones who destroy halters and blankets and stuff the whole time. And people think it's fun. And I'm just seeing frustration and stress in those horses. And that's as well like really to rethink if what we learned, what we see, and put our human like interpretation on it, sometimes we might be very,
Yeah, and I don't say that about the big paddocks to be bad. I just say that if we have this big paddocks with the horses, we have to continuous, check the horses
yeah,
on a regular basis.
yeah.
And
And
also, if you
yeah,
see
yeah,
an individual not getting along with the other ones, don't close your eyes. Take it out.
absolutely.
Yeah,
Absolutely.
yeah,
If you have, I mean, if a horse in his pasture time, even an adult horse, and the pasture time is in a group where they don't like the other horses or they are always pushed around, it's a permanent stress.
yeah. Okay, so overall, we have to understand more of the brain function to create this optimal um, neuromuscular plasticity.
Yeah.
And that's a process. So you can never quick fix it. So when I have the patient, as I said in the beginning, the gait is a window to the brain. And let's say that you have a lame horse and you go for the orthopedic examination. What do we look for? We look for the lameness, and we almost always see the horse in trot.
Yes.
Trot only. So the goal for success, success for the goal is to that the horse is not lame anymore, but that the horse is still cross cantering or not being able to flex to the inside or whatever. We don't see it and we don't think about it.
Yeah.
So this is why we come back with a new injury or the same lamenesses.
Yeah.
If I had to choose just one gait to look, I would always choose gallop. You can have a horse which is very big in the trot,
Yeah.
and then you see the gallop, and you say, "What? Is it the same horse?"
Yeah.
Because it's really show you if it's well functioning or not.
Yeah.
And most of the horses are not.
Absolutely not. Yeah. That's interesting that you say that because I know a lot of people who would say they would assess in walk as well, like looking for different, because I mean, trot can camouflage a lot. I mean, if you have the big asymmetry, it's as well, it's interesting. I read somewhere, it's like years ago, that the human eye in average can only perceive a lameness when it's 25% asymmetrical. And that's like, I'm like, what? I was shocked. I was like, that's like literally very lame already, and we don't even see it before. So it's like already to think about that as well. How capable is our assessment tool, our eye in that case? And I think as well, I don't know how you see that. For sure, you need to do the analysis by observing first and looking like how is the horse doing. But what I miss a lot as well is that to really assess touching. I mean, if even if you know, okay, my horse is lame in the front left, like obviously whatever, um, it's, people come with x-rays and stuff immediately. I'm like, you have hands. You can feel tension because the question for me is, why does this, I mean, in the rarest of cases, it's really that a horse outside stepped in a hole and then it got lame because it twisted something or whatever. Most of the time, lamenesses come from overcharge of structures, because that's like the furthest point of the compensation, which cannot hold it anymore. And this is where you get the problem, but that's like you're at the end of the chain, but you need to look back like where did it start? And this is something, for example, assessing with your fingers to feel like what is the reactions in the horse, and like seeing how does a horse communicate that this is stressing the horse and so on. That I guess that plays a big role in your assessments as well.
Yeah. In veterinary world for horses, we have this big group of decreased performance. What's that?
Sounds
It's
interesting.
just a lot of horses putting down because we don't know why. And if you have a horse with a decreased performance, and let's say that this is not lame, we start with maybe a blood sample to see if it has a subclinic infection, the muscle values, and blah, 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 blah.
Mhm.
Maybe we do x-rays, maybe we scan, maybe we do scintigraphy, maybe we do a lot of things. But all we do is with some kind of tool.
Mm.
So through a lens of one kind, and nobody is palpating the horse.
Yeah.
We only learn to palpate for the tendons in the pre-purchase examination.
Wow.
That's that's a nightmare. Have you ever had a sore muscle yourself? Let's say every riders have tried not to be ridden for a long, 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 long time, and then first time they go on the horse, we know that we have the inner thigh, and that can really, really be sore. So thinking about that, muscles is huge in pain.
Yeah.
We never examine muscle pain in horses.
Mm. That's a big issue.
So we look for pain, but we look for the joints and sometimes the tendons, but not the muscles. And
Mm.
muscles are the one who give the greatest amount of pain. I always ask the owner, when you move the horse, if you launch it or you ride it, is it getting better when it gets warm or does it get worse? Because that gives you an indication of, is this a
Yeah.
bone joint problem or is it a muscle problem? Um, so another thing I would like people to think more about is that you have an athlete in your hands.
Yeah.
Nobody think that way. In
No,
the
you're right.
human world, if you are, let's say you play football or whatever, almost every day you have some kind of treatment or
Hmm.
nursing your body.
Yeah.
In the horse world, you know what? Today it will be better than yesterday. Tomorrow it will be better than today. And for my next competition, it will be even better than my last competition.
Yeah. It's linear
No,
like that.
nobody, ignore body, but
No
nobody
body. Yeah,
can
exactly.
do like this. You
Yeah.
cannot increase performance in a slope like this.
Yeah.
It's not possible.
Yeah.
So we could learn a lot from the human athletes. So let's say that you are a professional cyclist and you are going for the Tour de France. Now it's just stopped one few weeks ago, and those cyclists are already started to make a schedule for the next year.
Yeah.
When I'm going to go down in training, when I'm going to train something else, strength. when
Hmm.
I'm going to do more, when I'm going to be treated, what I'm going to eat when, and blah, 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 blah. So nobody do that. Maybe on the highest level, they have a little thought about it,
Hmm.
but not really. They still think that
Yeah,
it can be better and better and better each time.
absolutely.
And this is why when you push the horse and the function all the time to be better and better and better, you fall down in this big hole. And I always say to my riders, look at the year's schedule. Find out which of the competitions is you would die to go. I mean, it's really important.
Mm.
And all the rest is just a wear on the horse.
Yeah,
Don't do it.
yeah.
So that's a big thing to get riders to think more of this is an athlete that I have in my hands.
Mm.
All my clients coming for me, unless they have known me for many years, they come when there is a problem.
Yeah,
Excuse me, you should have come long time before, because then you might not have the problem.
yes.
So, and last but not least, we also have a rider, and the rider does also have a brain,
Oh, yeah.
and they can have the same challenges.
Absolutely.
So in my clinic, I have two, weights where you can
Hmm.
see how much you weight, but you put one foot on each.
Yeah,
Then you have to close your eyes and stand with a good balance. And then ideally, you should have the same amount of weight on both feet. But a lot of riders, they don't. And it can be 1 kilo difference, it can be 12 kilo
yeah.
difference. Oh my God, how can you expect the horse to perform well if you have this big imbalance yourself?
Absolutely. This is like I'm glad you say that. I'm glad as well you say that about the that if you have a horse, it is an athlete because some people nowadays, because I do not, but the people I have, there's like very few who now have still interest in doing competitions and so on, because the more they understand about the horse, the more it's about the relationship and loving the animal and really looking like, oh wow, all these things I haven't thought about. And they love doing that. And still they enjoy riding and maybe do classical dressage things if the horse is ready for it and if they are for sure. But this idea of, oh no, yesterday I went out hacking, so this was no work. And I'm like, I mean, the moment you sit on a horse, it's work for the horse. There's something athletic to it to carry a rider because it's not made for it. And especially when they say, oh yeah, but I was just doing 1 hour and walk. I'm like, oh my God, that's like basically the worst you can do if you don't help your horse to carry you and itself. And
Mm,
this is like so funny. I mean, not even talking about tech not fitting and all the other things we could talk about, but it's this idea of what is an athletic performance.
mhm.
And I mean, most of the people nowadays are not very athletic themselves.
No,
And this is a problem if you do not, if I am the one trying, even with all my knowledge and I thought about my horse, I learned, I asked, and so on. And I try to feel, I need to learn how to feel as well. And if I don't feel myself, I cannot feel my horse. And this is as well a
that's a
connection.
funny thing. I was a very, when I was kid and young, I was riding a lot and also a lot of competitions.
Mhm.
And then I had a long break because, self-employed, 3 kids, and a lot of
Yeah.
studies in the other countries and so on and so on. And a few years ago, I think now I had to ride again. And even though I'm old and have a lot of issues, I think I'm a better rider now.
Yeah.
'Cause I have so much more feeling in my own body, and I have so much more feeling with the horse.
Yes.
So it's really awareness, which is a big thing.
Yeah.
Then you can add on what about the saddle and the farrier, and don't go down that road. It's just a long way.
Each one is a rabbit hole of its
Oh
own.
yeah, oh yeah. But one of the things are that I'm a little frustrated about. Many of the clients coming for me with the patient, um, they come after they have been spending 2 years and maybe many money
Yeah,
on different kind of examinations and treatments and and try to rehabilitate again and again and again.
yeah,
And if this horse, I know already that it has a dysfunction in the nerve system because otherwise they have cured the animal.
absolutely.
And oftentimes I'm the last before, you know,
I
and
know.
I would like that people acknowledge, let's start with having the right function from the beginning.
Yeah,
And I hope that a lot of this speak and many other speaks can increase the awareness in the riders and the horse owners that don't think just of it's sore in that muscle,
yeah,
or my chiropractor loosen it up, or it has a good massage. And because if you really think into it and be aware of it, you will see that you only have few days better, and then
mhm,
it's the same again.
exactly.
But we all live on this few days, which is better. Oh, it's better, it's better. And then after a period of time, you have the same issue again. And this is why it gets worse and worse and worse over a long time.
Yeah. So
So
I think this is, I'm really happy you said that. I think this is a good moment to end this conversation for today. About your frustration, I know the same thing. People come to me from my side. It's less this pure. No, it's a lot like body issues as well, but it's a lot of behavioral issues as well. People come to, and it's like I'm very often the last chance person to ask.
mhm.
And this is why I think such conversations like the one we had today are important because to do it right from the start, we need to have the knowledge about it. And a lot of people I still hear nowadays, they're like, oh, writing, and it's all about the feeling and whatever. No, you have to have knowledge what you're doing. You have to have knowledge about what type of living creature is this beautiful horse, how do we interact, and what are all the factors we need to pay attention to have a good start and to as well react at the right moment if something might go in a direction where, for example, from a neurological point of view, you switch into a pattern which is not helpful. So this
So,
awareness,
so what it's all about is that you have to uh, being able to measure the motoric output.
yeah,
When you have done that, you know what is working and what is not working in the brain. And then you have to stimulate the area which is not working
mhm,
enough, or down regulate the one which is too active.
yeah,
Because the chronic patients, they have a severe dysfunction in the autonomic nerve system.
absolutely,
And as soon as you have that, you have a change in mentality.
yeah,
Punctum.
yeah,
So when people ask me, well, I have this horse and it have this kind of symptoms, can you help it? I don't know, but I can examine it.
yeah,
And then I examine it and I use the body to balance the brain and make the new pathways in the right function. And then they do neuro rehabilitation. And over this period of time, you come back in full function again.
yeah.
So
Thank you very much for taking the time out of your busy life today to have this conversation with me. I'm very thankful. And yeah, hopefully we help to create a little bit more of awareness in the horse world.
I hope it. Thank you.